Let's discuss treatment options. It's always best to start with the least invasive. Let's start with behavioral modification. That consists of fluid and diet changes, watchful waiting, and Kegel and bladder retraining. Let's move on to first-line therapies. First, there are BPH medicines. There are alpha blockers and 5-alpha reductase inhibitors. Then there are first-line in-office therapies, resume water vapor therapy, and prostate urethral lift, which are permanent implants in the prostate. And moving from least invasive to most invasive are the surgical procedures. These are hospital-based procedures that require general anesthesia. There's the green light laser, there's the traditional TURP, and there's the laparoscopic prostatectomy. No dietary supplement, combination agent, or other non-conventional therapy is recommended for the management of LUTS secondary to BPH. This includes saw palmetto. What is watchful waiting? Watchful waiting involves lifestyle modifications such as adjusting diet, evening fluid intake, medication use, and exercise patterns. Medications. First, alpha blockers. What are alpha blockers? They help relax the muscles of the bladder and prostate, allowing urine to flow more freely. 5-alpha reductase inhibitors. What are they? They're designed to stop the growth or shrink the prostate by lowering production of the hormone DHT, a male sex hormone. Studies show up to 70% of men stop taking their BPH medicines within a year. Resume water vapor therapy. What is it? It's an outpatient therapy that uses the natural energy stored in water vapor to shrink excess prostate tissue. There's no general anesthesia, there's no permanent implant, and there's only a 4.4 surgical retreatment rate at 5 years. And now we will show an animation of how Resume water vapor therapy works.
This short in-office therapy shrinks your prostate, relieving your BPH symptoms and preserving sexual function.
And now you'll hear from Joe, a Resume patient, and his spouse, Terry.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. And went to my doctor, and he put me on some medication, told me I should see a urologist, which I did, and it was confirmed that I had a enlarged prostate. It got to a point where the pills really weren't working, and then one night I got up in the middle of the night to relieve myself and wasn't able to. I ended up going to the emergency room, and they catheterized me to relieve it. That happened 3 times. And after the 3rd time, we've decided to take some decisive action about it. Taking my medication wasn't a long-term solution for me, and I was looking for something to replace it and solve the problem, so to speak. And that's why I looked for new technology and Resume.
It was somewhat like going out with a toddler. You have to scout out every washroom. We would go out to dinner, and as soon as we would get to the restaurant, he would excuse himself to go to the restroom, and there I would be standing with the hostess. Then usually midway through our meal, he would have to go to the restroom again, and that happened for a few years. When we would travel on the road, he'd have to be stopping constantly, and I was getting annoyed because it would make our trip quite a bit longer. And then him getting up 3 and 4 times during the night, I knew he wasn't getting proper restful sleep. So that caused some concern on my part for him.
I first heard of Resume when I was researching enlarged prostate and the procedures to repair it, to fix it. And Resume was one of them. The more I researched Resume, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good.
When I first heard about Resume, I looked it up on the internet, and I thought, what? I had never known there was another avenue to go down that didn't involve cutting and much more invasive treatment.
My experience with the Resume procedure was very good. Didn't take a lot of time. It was not a lot of pain. I thought the technology was great. They showed me everything as far as the equipment that they were using and how they were going to use it. The technician from Resume was there to assist the doctor. I was very satisfied. After the procedure, I was a little worn, a little tired. And the next day I felt fairly good and was able to get up and get around.
Since Joe's resume procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The resume treatment has made a very big difference in our life.
Oh, it's been absolutely great. I find myself not going to the bathroom as frequently. I'm able to sleep through the night, get a good night's rest. I'm thoroughly pleased. The resume treatment has helped me resume my life.
Prostate urethral lift. What is it? It's an outpatient procedure that utilizes permanent implants to lift and hold enlarged prostate tissue out of the way so it no longer blocks the urethra. There's no general anesthesia, there are permanent implants, and the surgical retreatment rate is 13.6% at 5 years. Green light laser therapy is an outpatient procedure that uses a laser to vaporize away the prostate tissue. There is general anesthesia, there are no permanent implants, and the surgical retreatment rate is 4.8% at 5 years. Now we'd like to show you an animation of how the green light laser works. Transurethral resection of the prostate, commonly known as TURP. A TURP is an outpatient procedure that uses a heated wire to cut through prostate tissue. There is general anesthesia, there are no permanent implants, and the surgical retreatment rate at 5 years is 5.8%. Prostatectomy. A prostatectomy is an outpatient procedure that involves surgical removal of the inner portion of the prostate via an incision in the lower abdomen. And the surgical retreatment rate at 5 years is 2.7%. Insurance coverage. It is the responsibility of the patient to contact their insurance provider for specific coverage information. Next step, consult with your urologist to determine which treatment option is best for you.